Today we're going to address a very crucial question. Is nursing right for you? Thinking about a career in nursing? It is a rewarding career, but it's not for everyone. Let's explore the realities of nursing so we can help you decide. Nursing is more than just a job. It's a calling, but how do you know if it's your calling? We'll cover everything from personality traits to practical considerations. So there are a few personality traits that you should probably possess or be working on before you enter into the nursing profession. Starting with empathy and compassion. Are you genuinely empathetic? Are you constantly or most of the time putting yourself in someone else's shoes? Is this hard for you or is it not hard for you? Nursing requires deep compassion, as you will be the one that spends most of your time with the patient and understanding. Are you able to communicate with people from all walks of life? Are you able to be compassionate even though you're not from that walk of life? You're not a drug addict, never been, don't know anybody in your family that is a drug addict. Are you able to provide compassion for this person? Are you able to be compassionate to this repeat patient that has gotten off drugs and now is back on? Can you be compassionate? You have to be compassionate with people even when they're at their worst. Resilience and stress management. Nursing is a high stress profession as well. In a high stress environment. Things may be constantly moving depending on the department or on the unit or on the floor that you're on. Are you able to handle long shifts, emotional situations, and the pressure of life or death decisions? Are you resilient? Can you bounce back from a bad shift, a bad night, a bad call? Can you bounce back from difficult experiences and still have a positive attitude and remain professional? Do you have communication skills? Now, this does not matter if you are an introvert or an extrovert. Are you able to communicate effectively with your team or another patient when you're educating them about their condition? Effective communication is key. You clearly explain complex medical conditions to a patient and their families. Are you a good listener? Can you build rapport with people from different and diverse backgrounds? Now, this is where my introverts excel. So if you are an introvert wondering if you should enter this profession, yes, if you can communicate clearly and if you are a good listener. You do not have to be Mr. or Mrs. Get to know everyone and be that extrovert that everyone in every other job expects you to be. This job is perfect for you still. Can you problem solve and think critically? Now, this is going to be key, especially in nursing school. They're going to drill this into you. Can you think critically? Critical thinking is key. You'll find that when you take the tests, the answers are not what you think they are. So it's right, but it's not all the way right. Nurses are constantly problem solving. Can you think critically in high stress situations and make a good call? Can you think critically in high stress situations with lots of pressure and still make sound decisions? Do you enjoy constant learning and staying up to date on the latest medical advancements? Physical stamina. Now, you might think that you need to be really in shape to be a nurse, but the key here is, can you stand? Can you stand and walk? A lot. Are you able to move another person and other physically demanding tasks? Now, this is one that if you are not capable of doing this all the way, it does depend on what floor you work on, and it also depends on the team that you work with, because you will be surrounded by a team that is willing to help, but not with everything. So these are considered things that you need to consider. In nursing school, it is academically rigorous. Be prepared for challenging coursework, long study hours, and rigorous clinicals. Are you willing to commit for 2 years to hands-on learning and studying? This is a science-heavy curriculum that you will need to memorize information, but also be able to think critically in order to apply that information. So what seems right may not be right all the way, or maybe partially right, but in addition to these things, it also depends on what is going on in the moment and with each individual patient. Clinical rotations. Clinical rotations will expose you to what it really is like to be a bedside nurse. Are you capable and ready of dealing with patients in different emotional stages of their life? Are you ready and willing to clean up a patient and take care of a patient when they're at their most vulnerable, naked in front of you, however that may mean, whether it mean physically or emotionally naked, and exposing their life or the fact that they've been an addict for 15 years. Be prepared to experience emotional things. Be prepared to experience emotionally challenging situations. Time commitment. Are you willing to put in the time and the work? Because nursing school requires a significant amount of your time. Can you balance your studies with the rest of your life and other responsibilities? If I had to turn the clock back to my nursing school days and figure out how much time I needed to study, I would say between 15 and 20 hours a week, or per test that I was trying to study for. And it requires a lot of time. You must study for your hands-on tasks because you will be tested on those skills physically in your lab setting at your school, and you also must study the other things from the textbook. So it's a two-part type of program, except you get all those parts in one. So it requires a lot of your time to study both the skills and also the knowledge that you need for your assessments and other things in nursing. So be prepared to spend a lot of time on your study. Financial considerations. Nursing school can be expensive. Do you have the money to go? Have you figured out financially how you are going to cover this program? Do you have those things in place? Will you work or are you not going to work? Do you know about financial aid, scholarships, or grants that can help you go? Now let's talk about the realities of the nursing profession. There are long hours. 12 or more, and on top of that, they may ask you to stay over. They might offer you overtime, and it's up to you to take that, but sometimes it is mandatory overtime. Have you ever worked nights? Because some of you, when you graduate from nursing school as a new grad, have a high possibility of starting out as a night nurse or a night shift nurse. If you are not used to that, are you willing to work irregular hours or nights and weekends as well? Be prepared for the toll that shift work may have on your body. There's emotional demand. So much happens in the hospital that you must be able to care for yourself emotionally for. Self-care will be of utmost importance. So if you don't start taking care of yourself now, you better start. There are different career paths and organizations that you can work for. You don't have to just be a bedside nurse. As you see, I am a work from home nurse at the moment, and so many avenues and different ways that you can level up your degree. You can enter the workforce as an associate's degree nurse and go all the way up to your DNP, which is a doctorate in nursing. So many different careers and avenues to explore in nursing. You can also be an informatics nurse, which is a combination of nursing and technology. If you didn't know that, that may be for you. Nursing is in high demand. Always job security, at least for now, until the robots take over.
Really hoping that statement ages well.
But always job security when it comes to nursing. If you really want to know what it's like, I would say shadow a nurse, but I do believe that those days are long and gone with the implementation of HIPAA. You will be hard pressed to find anybody that you'll be able to shadow because of protected health information. So I would choose to volunteer in the healthcare setting. You can volunteer as a transporter, transporting a patient from X-ray to the lobby, or a volunteer that helps people find their loved one within the hospital when they come to the visitor's desk. These are great opportunities for you to get your foot in the door as well when it comes time to find a job. You can talk to nursing students and even professionals on forums, get to know them, or you can read forums about their situations as well to find out the real experiences that they go through. Research your different nursing programs and find the one that is suitable for you and meets your criteria. And also, are you fulfilling the requirements for the nursing program? Do you have the grades? Consider your motivation. Why do you want to be a nurse? It can range all the way from I want a stable career to I really love people. However, If it is on this end of the spectrum of I want a stable career, it's not that you care exactly what the job entails but have some kind of idea about it, I would recommend that you really search your soul and figure out if you, with just that, armed with just that motivation, will you be able to control yourself in emotional situations or when a patient is trying to swing at you? Are you able to handle yourself and these types of high stress situations knowing that your only motivation was to have a stable career? So really search your soul on the reason why you're doing that. Don't rush the decision. Take your time. Ultimately, the decision is up to you. Do not let anyone tell you that you cannot do this, because no matter your personality or what age you are, well, of course you can't be like a toddler, but like you know what I mean. You can become a nurse. So whatever your decision, take your time, make sure that you're making a well-informed decision about your abilities and if you are willing to pursue and do this career. It is challenging, but incredibly rewarding. If you are passionate about helping others and making a difference in this world, this is the career and profession for you. Anyway, if you have any questions or comments, please leave them down below. Again, with the crazy hair, I do not care. But thank you for watching and hope to see you in the next one. Bye.